I saw an article in the New England Journal of Medicine in August of 2000 about Pravachol, which is a cholesterol-lowering drug, reducing the risk of stroke. And it seemed to be a biased article. So I went through it very carefully, and then I got in touch with a research expert in Boston to review my critique of the article with him to see if he agreed with me. So he went through it point by point and said, yes, he thought I was right. He didn't see anything wrong with my analysis. So I asked him if he would be interested in writing a paper with me. I thought it would be very powerful if a practicing family doctor and a research expert wrote a paper together to help to immunize practicing physicians from the growing commercialism in even our most respected journals. He said to me, well, I'd rather not. I do a little consulting for the drug companies, and I'd rather not get involved. And that really was a turning point for me, because I naively had believed that the universities were the overseers of the integrity of medical science and knowledge in general. And that showed me that there's enough drug influence in our best researchers so that the oversight function was no longer functioning. And then a year later, I saw a review article in the New England Journal again about Celebrex and Vioxx, and it seemed to be very clearly biased in favor of promoting those drugs. I noticed that both of the authors had financial ties to the drug companies, and at the time that was against the editorial policy of the New England Journal.
Now these journal articles are handed out by salespeople in doctors' offices. So now if they can't rely on the journal articles, they're even more hard-pressed to find out accurate drug information.
This transformation in the purpose of that knowledge has happened so quietly that the watchdogs not only haven't been able to keep up with it, but the watchdogs are largely drugged. So more than half of the budget of the division of the FDA that approves new drugs and oversees drug safety is funded by the drug companies. 90% of the clinical studies are funded by the drug companies. 59% of the experts who write the clinical guidelines that create imperatives for us to follow have an active financial relationship with the drug that's being considered in the guideline process. About 70% of our continuing medical education that doctors participate in to maintain their state licenses is funded by the drug companies. And we all know that there's now one drug rep for every 4.5 practicing doctors. So the drug companies are spending about $30,000 per doctor each year for marketing.
The pharmaceutical companies spend a lot of money on marketing. It's probably close to, in 2005, probably close to $20 billion.
It's well documented that the drug industry spends roughly twice on marketing what they spend on research and development, and this really demonstrates the drug industry's skewed priorities.
And though industry will say the marketing costs don't affect the cost of drugs, they do say the research costs affect the cost of drugs. So though I'm not an economist, I don't see how you can have one but not the other, and that in fact, just like the research costs may affect drug costs, I guess that marketing costs probably affect them too.
They're more interested in marketing drugs of questionable innovation to the American public than they are in researching genuinely innovative drugs that will be real breakthroughs for diseases that not just Americans but people all over the world are suffering from. So the fact that they spend twice as much on marketing as they do on research really undercuts their argument that they need the high prices that they force us to pay in order to somehow pay for all this supposedly innovative research that really isn't taking place.
First of all, they always claim that their prices have to be high because of all the research they do. Well, in truth, most of their research goes towards Me Too drugs. Those are drugs that just simply imitate other drugs that are already on the market that do the same thing. They're not saving lives. They're not changing things. They're just a different drug company trying to get a piece of the market.
The notion that we got to learn zillions of things because there are millions of journals being published every month is just not true. In fact, very little that comes out in the 30 years that I've been a doctor has really changed my practice, has really been important. There have been a few things, but you know what? It wasn't hard to know about those things. Those things were so dramatic that you couldn't help but learn about them.
Good example, the All-Hat study compared diuretics, fluid pills, which are very inexpensive, beta blockers, which are very inexpensive, and then 3 expensive classes of antihypertensive medications. Well, it turned out that the diuretic that costs only $30 to $50 a year was equal to or superior to all the other drugs in preventing the complications of high blood pressure. So the British Medical Journal published a wonderful article in which they interviewed a strategic marketing consultant for the drug companies, and the interviewer said, well, isn't this going to be a problem? Your expensive drug is not as good as a drug that costs $30 or $50 a year. And he said, no, this won't be a problem. We have a $10 billion industry. We'll have 55 promotional events, and this data will go away. It'll fade away. And I believe he was right. It did fade away.
And this is another thing that gets gross, is when they come out, because it's going to go off of patent, right? So it's going to be, a generic can be made. Well, they just switch the formula ever so slightly, so we get 3 more years of exclusivity to the drug, and we can still charge our premium prices.
Nexium, we have all seen the TV ads for. It's the so-called healing purple pill. And many people know that it is a successor to Prilosec, which was the original purple pill. The main difference between Nexium and Prilosec is the yellow stripes they added to Nexium and the price. Now, Nexium is 7 times more expensive than Prilosec. The piece of information that AstraZeneca is not too anxious to publicize is that there is basically little or no medical difference between those 2 drugs. Basically, Nexium is a chemical mirror of the active ingredient of Prilosec. It's called an isomer. They've taken pains to try and portray it as though it's different, but they haven't really been able to do so. In fact, the main studies they did to demonstrate that it was somehow superior really didn't do a fair comparison. They compared a 40 milligram dose of Nexium to a 20 milligram dose of Prilosec. And even when they did that, the differences were really marginal at best, and in one of their studies, no difference at all. When they put them head-to-head, 20 milligrams of Nexium against 20 milligrams of Prilosec, there was no difference.
If they were to say, look, I'm making the 19th version of the same drug that never worked in the first place, and we have older drugs that are even cheaper than all of them, and they're just as good, and what's more, it isn't even a disease, we're just making it up. Shyness is now social phobia or something like that. If they were to say that this is really just about making money, they wouldn't make a lot of money. So they're smart enough to know that the way to make money is to convince us. And when I say us, I mean at all sorts of different levels, that this is really about a noble search for science and health.
Objective, cutting-edge science coming out of the top universities in this nation is often marketing dressed up as science. You know, you can put lipstick on a pig, but it's still marketing.
Supposedly, the web opens up medical information so people can do their own research. But studies show that about 80% of the material that people find on the web about medical care is commercially motivated, whether or not it's identifiable as such.
And there are a number of groups on the internet that look like these bona fide, disinterested patient groups that would only want the best thing that's right for them. And you come to find out that they're 100% funded by a drug company.
Unfortunately, the FDA currently only requires, when you are seeking to have a new drug approved, that you show that that drug is better than a placebo. In other words, that the drug is better than nothing. That's really not very useful information for the doctor. They don't require that drugs be compared to each other. And that's a huge gap in our medical system. And other countries do require that drugs show that they're an improvement over what already exists, and do research to show how they stack up against each other. There are some publications and research institutions that are doing this kind of research. The biggest one, the most important right now, is the Drug Review Effectiveness Project at the Oregon Health Sciences University. And this basically is a meta-analysis where they collect all the different studies comparing drugs within a class to each other, and they make conclusions about how they stack up and which ones are really the most effective. Now, for consumers, much of that research gets distilled on a website done by Consumer Reports. It's called Best Buy Drugs. And they do essentially for drugs what they've done for years for refrigerators and vacuum cleaners and other products, which is tell you within a particular, say, group of heartburn drugs, which one is the best buy, the most effective for the money. So things like that are really important resources. And that website for the Consumer Reports Best Buy Drugs is crbestbuydrugs.com.
Even when physicians could see through some of this stuff, even when they could say, you know, this isn't right, the drug companies would do an end run around the doctors and go straight to the patients with direct-to-consumer advertising. and patients would start demanding these drugs. And what they found was, a study clearly showed that when patients ask for a drug, doctors will often yield to that request, even when they know that's not always the best choice.
I had been in practice for 20 years. I closed my practice 10 years before, so all the patients in my practice I had been working with in a small town for at least 10 years. There were many of my own patients that I could not convince that these drugs weren't better. They would come in asking for Vioxx and Celebrex, and I would say, look, I know as much about this as anyone in the country who's not working in the drug companies, and these are not better drugs. And my patients would say, well, I saw them advertised, or even more emphatically, my friend had them prescribed by a specialist, implying you're just a family doctor. And many people said, if you don't prescribe them for me, I'll go to another doctor who will. And I could not convince people that I was looking at the original research and that it showed that the drugs were more dangerous.
The reason 20 million people took Vioxx